Second week after trabeculectomy, easing into daily activities. After trabeculectomy, glaucoma filtration surgery, the first week is usually very gentle, plenty of rest, limited movement, and protective measures like an eye shield as directed by your surgeon. By the second week, if your doctor gives the all clear, you can begin to gradually resume light activities. For example, many patients feel well enough to do easy housework like dusting, cooking, or folding laundry, and even return to light desk work or remote work around 1 to 2 weeks post-op. A health guide notes most patients can return to their normal routine by week 2. Listen to your body. If your eye feels uncomfortable or tired, slow down or take a break. Don't rush, your eye is still healing. Safe chores and work light household tasks. Easy chores, such as making the bed, light laundry, tidying up, are usually okay after week 2. For example, one eye clinic advises that patients can bend and do usual household tasks, and even gardening soon after surgery. Make simple tasks easier. Use a cordless vacuum or small hand vacuum for dusting, which reduces bending and lifting. A rolling laundry cart or tote can help move clothes without carrying heavy baskets. Remote work tips. If your job allows partial remote work, start with just short periods at a computer. Position your screen at eye level, sit in a well-lit room, and minimize overhead glare. Take frequent microbreaks. Follow the 20-20-20 rule, looking at something about 20 feet away for 20 seconds every 20 minutes. This helps relax your eye muscles and prevent strain. You might also use dictation tools or screen readers to reduce long periods of reading. Many phones and computers have built-in voice-to-text or text-to-speech features. For instance, smartphones often offer voice dictation and screen reader accessibility tools. These can help you work without staring at the screen for hours. Lifting, bending, and exercise. Avoid heavy lifting. For at least 2 to 3 weeks, do not lift heavy objects. In many guidelines, N evitaris 4F edzico forte, and no carrying weight above 5 kilograms, about 10 pounds, for the first 2 to 3 weeks are recommended. Think twice before lifting anything heavy. Ask for help with groceries or laundry bags. Bend with your knees. When picking up objects, bend at your knees rather than bending over at the waist. Keeping your head above chest level helps avoid spikes in eye pressure. A Brazilian post-op guide specifically warns to be careful, ao abaixar a caba além linha do ombro, i.e., not to lower the head past shoulder level. This is similar to general advice after eye procedures. Don't stoop forward too deeply. Instead, squat or kneel to reach lower items. Gradual exercise. Avoid strenuous exercise or heavy housework for the first 2 weeks. This means no running, aerobic workouts, or intense gym sessions. After 2 weeks, you can slowly ease back into gentle exercise, like walking. Always follow your surgeon's guidance. If in doubt, double-check before attempting anything too energetic. Skip head-down positions. Activities like yoga poses that put the head below the heart, e.g. downward dog or forward bends, can sharply raise intraocular pressure. It's safest to avoid inverted or head-lowered positions until you're fully healed. Protecting your healing eye. Hand hygiene and drops. Infection prevention is vital. Always wash your hands with soap and water before touching your eyes or applying drops. Your doctor will prescribe antibiotic and anti-inflammatory eye drops and sometimes a steroid drop to prevent infection and control inflammation. Use them exactly as directed. For example, GoodRx notes that after common eye surgery, patients use antibiotic and anti-inflammatory drops to prevent complications such as eye infection. Similarly, a trabeculectomy post-op guideline stresses that antibiotic and steroid drops are fundamental to a successful recovery. Avoid touching or rubbing. Never rub or press on the operated eye for at least the first week. Even after that, be gentle. If you need to clean around the eye, do so very carefully. One care sheet reminds patients to keep water, soap, shampoo, and other products out of the eye, especially for the first week. When showering, wash above the eyes with closed lids or use a gentle spray away from the face. Avoid swimming pools, hot tubs, or anything that might expose your eye to bacteria for at least a month. No makeup or lotions. Do not wear eye makeup, mascara, eyeliner, eyeshadow for about 2 weeks after surgery. Also, avoid applying perfumes or skincare creams near the eyes during this time. Keeping the eye area clean and free from potential irritants helps prevent infection. Sun and light protection wear. UV blocking sunglasses. Your eye may be light sensitive after surgery. Protect it outdoors with wraparound sunglasses that block 100% of UVA UVB rays. The American Academy of Ophthalmology recommends UV 400 sunglasses. These block all harmful rays for outdoor use. In the first week especially, wear sunglasses anytime you go outside. This shields your eye from glaring light, wind, dust, and pollen, which can burn or irritate a fresh surgical site. The Southwest Eye Institute notes that sunglasses make the light sensitivity transition far more comfortable and protect healing eyes from UV and debris. Use clean shields. Keep your sunglasses clean. A Brazilian clinic suggests washing post-op protective eyewear with soap and water and putting them on by the arms rather than touching the lenses. Clean, well-fitting sunglasses or a plastic shield, often provided by your doctor, can also be used indoors or at night to prevent accidental rubbing while sleeping. If an eye shield was given at night, continue wearing it for the first week or as instructed. Reducing eye strain. Even while recovering, digital screens are often necessary for work or leisure. To prevent digital eye strain, follow these tips. 20 to 20-20 breaks. Every 20 minutes, take a 20-second break and look at something about 20 feet away. This simple 20-20-20 rule is recommended by eye doctors to relax the eyes. Setting a silent timer or using a break reminder app can help you remember. Blink often. Remind yourself to blink fully, especially if you feel dry. Blinking refreshes the tear film and keeps your eye lubricated. Optimize your screen. Use larger text and higher contrast on your computer or phone so you don't have to squint. Position your device so you can sit upright with the screen at or below eye level. This also helps keep your neck relaxed. Reduce glare by using curtains or an anti-glare filter on the screen. Voice personal assistants. Take advantage of speech-to-text or voice assistant features. For example, you can dictate emails or documents instead of typing and reading long passages. On smartphones, voice commands, like Siri or Google Assistant, can control basic functions hands-free. For extensive reading, consider text-to-speech apps or built-in screen readers. Scheduled microbreaks. Throughout your day, stand up, stretch, and rest your eyes for a minute or two. Simple neck rolls and gentle shoulder stretches help you relax and improve circulation. Just avoid bending forward deeply while stretching. Conclusion. By week 2, many patients find they can cautiously increase activities while still taking precautions for their healing eye. The key is moderation and protection. Stick to light housework and taking short stints of remote work with frequent breaks. Continue to follow your surgeon's instructions on drops and follow-up visits. Avoid lifting heavy items or intense workouts for at least 2 more weeks. Always protect your eye from infection and from UV debris by keeping hands clean, using your medications, and wearing sunglasses outside. Your eye is healing, but with these gentle guidelines and simple aids, like a lightweight vacuum or using voice dictation to rest your eyes, many normal activities can resume. If anything feels off, such as increasing eye redness, pain, or vision changes, contact your doctor promptly. Otherwise, implementing these care tips should help you recover comfortably and safely. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.